A third of patients receiving perhaps unnecessary treatment, or what the media might phrase as unnecessary. It's not that it's unnecessary, but it's, with no pun intended, it can be overkill. Well, patients will do well getting a total knee replacement. What I'm saying is a lot of patients, or a third of patients on average, do just as well getting something that's less invasive than a total knee replacement. Well, people are coming to the doctor because they need something. And it's ostensibly because for a knee problem, some have limits to them. You mentioned cortisone injections, for example, and that's a great example because say a patient's come in and they've had 3 or 4 cortisone injections into their knee, and none of those help, or they only help for a couple of months. It's not ethical nor proper for a surgeon to offer continued cortisone injections ad nauseum. If you have end-stage arthritis in the knee, if you've tried cortisone shots, you've tried activity management, anti-inflammatory medications, sometimes bracing and physical therapy, and it's been getting worse, and it's reached the point where you're not able to dispense with your daily activities, well, it's time for surgery. Partial knee replacement is a tiny little incision about 2 inches long, whereas even the smallest incision for a total knee replacement, it's 4 or 4.5 inches long. So it's that much less pain. There's less work done on the inside, so it's that much less pain. Overall, it's about a third as much time in the hospital, 1 day versus 2 or 3 days. It's 2/3 less pain, and the risk of complications is about 2/3 less. So the average patient getting a total knee replacement, it might take them 3 to 6 weeks to get off of crutches or a walker. With a partial knee replacement, that patient is usually off a cane or crutches within a week or so. And they're out of the hospital in a day. They're back driving within a week, and in many cases back to work within a week too. And one of the other arguments about partial knee replacements, well, they don't last that long. But in reality, if they're implanted properly and patients don't have any complications, they do last just as long, or almost just as long, as a total knee replacement, and you're looking at a longevity for the device in the range of 20 years. It's much easier to revise a partial knee replacement to a total knee replacement than it is to take out a total knee replacement that's failed and put in another total knee replacement. So it's the younger patient, and then also the part that's not intuitive is the very old patient who may not tolerate undergoing a total knee replacement. These are the patients in the 85 and older category who may do very well with a partial knee replacement. In fact, I had a 94-year-old fella who I did a partial knee replacement on, came back for a 6-week post-operative visit, and I asked him, and it was his right knee, I asked him, well, how'd you get here? He said, I drove. So the point is, the very old patient who's lost their mobility because of knee arthritis, who would have a very hard time and might have an unacceptably high complication rate with a total knee replacement, will do just fine with a partial knee replacement. People in the middle, the people between the ages of 60 and 75, who generally were getting more total knee replacements than partial knee replacements. It's the younger and the older patients who were doing really well with the partial joint replacements, especially the older crowd. The younger patients were doing other type of restorative surgeries that don't involve the implant of metal and plastic parts, which is what a partial and a total knee replacement are made from.